Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our politics panel on talks to end the teachers' strike. But first, applying pressure on another labour front.
HSAA is strike ready. Members
of the Health Sciences Association of Alberta rallying earlier this month outside an Edmonton hospital, calling for a better deal after having rejected a tentative agreement with Alberta Health Services in September, a deal that included a 12% general wage increase over 4 years. And joining us now, Leanne Alfaro, Vice President of the Health Sciences Association of Alberta. Ms. Alfaro, great to meet you. Thanks kindly for coming in to chat with us today.
Yeah, thank you.
Now, both sides have appeared to be open to a return to bargaining. Are you back at the table talking? Where does bargaining stand?
And great question. We're certainly looking for all those answers too right now. But I'd like to start out with just explaining who HSAA is. You know, we are a union that represents 30,000 specialized healthcare professionals across Alberta in all different health sectors, whether it's acute care, community care, home care. So we have members all across this, including our paramedics, our dispatchers, right, from 9/11 to get the ambulances, that care out in emergency. We have our diagnostic imaging technologists, so anybody having an MRI, CT, X-ray, etc., those are our members providing that. Cancer care, radiation therapists, those are our members. We have members in occupational therapy, physiotherapy for rehabilitation and recovery, and our mental health therapists, whether it's psychologists, social workers, addictions counselors. Again, just a wide breadth of members that I really want people to know who we are and who we represent. And right now we're facing this unsustainable workloads, right, and a severe burnout. So yes, we have been pressuring to get back to the table since our members rejected the offer, the tentative agreement on September 10th. So we're well over a month. We've had some informal discussions, and we have just found out, we were expecting to get back to the table actually this month in October, and we have now found out that the employer is delaying that until mid-November.
Why is that? Or what have they told you as to why it is?
The reason we have been given is that one person is on vacation, and so they're not able to come to the table till mid-November.
How does that sit with HSAA leadership?
With our leadership and our members, not very well. You know, to continue to delay after, we've been without a contract for 18 months. Our members are still showing up every day for patients, working under these unsustainable conditions. And now to hear a further delay and a further delay, after informal discussions of saying they were willing to come back, after the finance minister put out a release on the day we held our rallies that we are at the bargaining table. So it's more than disappointing. It's our members, and we're feeling pretty disrespected right now.
Well, in your members rejecting that tentative agreement last month, as you reflect on that, why was that not good enough for the members?
It really just didn't deal with the issues, right? Like these, again, the unsustainable workloads, constant short staffing is just not sustainable. How are we going to fill the vacancies? How are we going to retain who we have? We know healthcare professionals are leaving the profession altogether, and they're leaving Alberta to go elsewhere because we are in a global crisis in healthcare, and we know short staffing is the main reason why.
Okay, so in looking for a new deal, do you build off that previous tentative agreement? What does a new deal need to accomplish from your perspective?
It needs to be able to address those biggest concerns, right? Which is going to come down to investing in healthcare. We know the government needs to invest in healthcare in Alberta, and it needs to invest in the people, which does come down to wages, benefits. How are we going to recruit more people into these professions? Many people aren't going into healthcare in general because it's not sustainable when you see what you have to endure.
We know the teachers are not necessarily back at the bargaining table, but did return to the bargaining table this week. To what degree does that situation potentially influence the outcome of where your bargaining goes?
Well, I mean, we're not sure how it's going to influence it. I think.
Are you paying close attention?
We're absolutely paying close attention to anything, right? Any of the negotiations going on within the labor movement, whether it's the teachers, the AUP right now with their nursing staff. We pay close attention to all of that. And as union leaders, we have conversations. We know, what is going on. So as far as influence, but again, our focus is on our members. We watch to see what's going on. But again, we're here to bring our members' issues forward in healthcare.
We heard the clip of Mike Parker off the top at one of the rallies earlier this month. And he expressed his words, HSA is strike ready. Have you backed off on that, or is labor action still a possibility?
It's still a possibility, right? It's still there. We are prepared. But honestly, I think we have to look at, we're healthcare professionals. We don't want to have to go on strike. We care about caring for our patients. That's why we go into these professions. So are we ready? Yes, because we have to be. Our members know. And after so many years of, when the economy was bad, right? So zeros. There's been years of very low to no wage increases. And our members keep going and keep going. And at some point, it gets to the point where you just can't anymore. It's not sustainable.
You're 1 month removed from the failed ratification vote. Now it sounds like you're 1 month away yet from a return to the bargaining table. So what is the mindset of your membership at the moment?
Our members are very anxious. Our members are very concerned. They're concerned for their patients. They're concerned for themselves, of course, their families. This impacts their entire life. And the waiting just gives more anxiety, right? And it's pushing it further and further. And the big questions we get is why? Why are they delaying? An organization the size of Alberta Health Services to tell us that it's because one person is on vacation is not acceptable. So we're hearing a lot, trust me, since we put out word to our membership yesterday. We're hearing a lot, and we are pressuring further to get back to the table this month.
All right. Ms. Alfaro, appreciate your time this evening. Thanks kindly for coming in.
Yeah, thank you so much.